I wanted to put this up for some of you. You may have seen this. It's something called soap, and it's what we use to design or formulate our treatment notes when it comes to writing down what we've done on a patient during a procedure. And we always want to think about it in this format where it's S, which stands for subjective, O stands for objective, A is assessment, P is for plan. And the two most important things that we're going to be focusing on when it comes to an endodontic diagnosis to see if a root canal is going to be needed on a tooth is by focusing on the subjective and the objective. The subjective is going to be the chief complaint. What is the patient coming in saying that they are experiencing? What are their symptoms? Is it pain when they're biting? Is it pain when they're drinking something hot or cold? Is there sensitivity when they're eating something sweet? It's what the patient is telling you is going on. Also, how long has it been going on? Has this been going on for a couple days? Has it been a week? Has it been months? That's important for us to know. So that is going to be part of subjective. Objective is going to be what we can see. What we can see when we're looking at the patient extraorally and intraorally. And also, once the dentist does his or her exam, what it is that they're seeing. It's going to consist of, like I mentioned, the extraoral exam, the intraoral exam, and also any radiographs that were taken. Because a patient could be experiencing these symptoms, and when we are looking visually in the mouth, we may not be able to see anything going on. Even if we've taken an x-ray, we may not be able to see anything going on, but doesn't mean that there's not, the patient isn't experiencing anything, which is why we want to make sure that we're doing a thorough exam. So with that exam, what they normally do is they work on the tooth that the patient is complaining about, and also focusing on what's called a control tooth, because they want to see how the patient is going to respond to some of this testing using a tooth, preferably the same tooth, just on the opposite side of the mouth. So if we're using a first maxillary molar, we don't want to use a lower maxillary molar. We want to use the first maxillary molar on the opposite side from where the patient is complaining about. So they're going to do a series of testing to see how the patient responds to stimuli on the control tooth, and then they're going to do the same exact thing on the tooth or the teeth that the patient is complaining about, because they want to see how the patient's going to respond. It's going to consist of palpation and percussion. So percussion is where the dentist is going to take the back of usually the mouth mirror, and they're going to gently tap on first the control tooth, kind of get a sense for what the patient is feeling, and then they're going to do the same thing on the tooth that the patient is complaining about. Are they experiencing pain? Are they experiencing nothing? They're also going to do what's called palpation, and palpation is where the dentist is going to just feel around the tissue surrounding the tooth, just to see if they're feeling any lumps or bumps, or if the patient is complaining of any discomfort or pain as the dentist is applying pressure to those areas. And again, they're going to do the same thing with the control tooth, which is going to be the tooth that's considered to be normal, and then the tooth that the patient is having the pain, experiencing the discomfort or pain. They're also going to do possibly a thermal sensitivity test, and it's typically done with ice. It can be done with either an ice cube, or it can be done with something called Endo ice, where they spray a little bit of the Endo ice onto a cotton pellet, and then they apply that to both the control tooth and the tooth that the patient is exhibiting symptoms from, and they're going to see what kind of response the patient gets from that. If the tooth is vital, then they should feel cold, a sensation of cold. If the tooth is non-vital, then more than likely the patient is not going to feel anything. And if the tooth is beginning to die, it's in that beginning stages. Oftentimes they'll get relief from something cold on their tooth. You might even hear that patients come in and are complaining and saying, the only thing that seems to relieve this is if I have ice kind of sitting in that area, it seems to relieve the pain. That's a good indication of the tooth beginning to die. Again, no response to the cold or the endo ice or the ice cube indicates usually that the tooth is already non-vital. It may also consist of an electronic pulp testing where they take a device, it's usually battery operated, they stick something into the corner of the mouth that's on the opposite area to sort of ground the patient, because what they're doing is they're sending an electrical current to that area to see if the patient is able to experience any kind of tingling sensation as a result of that electronic pulp tester. So again, they're going to do the same thing to the control tooth because they want to get a sense for what the patient is experiencing, and when the patient begins to experience the tingling sensation in the tooth as the dentist increases the amount of current that's going through. And then they're going to do the same thing to the tooth that the patient is experiencing the problems with, and getting a sense for if the patient is experiencing no sign of tingling, or if they feel a tingle but they're pretty high on the dial when it comes to the increasing of the electrical current, then that could be an indication that there could be some pulpal damage to the tooth. It can also obviously consist of looking at radiographs just to make sure that there's no abscess, infection going on. That's again indication of some pulpal damage if there is a clear indication of an abscess. So know the difference between subjective and objective, and the different types of testing that the dentist is going to use in order to make a diagnosis of whether endodontic treatment is going to be needed on a patient, and what those tests consist of and what they look like.